Hello everyone, I am Dr. D.K. Umashankar. I am a consultant in advanced laparoscopic, bariatric and colorectal surgeon. Today I will be speaking about inguinal hernias. Inguinal hernias are the most common cases nowadays we are seeing in the hospital. So what is hernia? Hernia is a protrusion of the bowel intestines outside the abdominal cavity. How it happens, when it comes. So hernia can come either after the birth when there is a weakness in the abdominal wall, or it can come in the patient who is having continuous cough for long duration. It is more common in gym going people, bodybuilders who lift heavy weights for longer durations. What happens in these conditions? The abdominal wall, the muscles, they become weak, and once they become weak, they opens up, and then there will be a small hole in the muscle, and then from inside the outside all the intestine they comes out. This is how we call as that you have an inguinal hernia. Then how do you know about it that you have an inguinal hernia? So what patients of inguinal hernia comes to us is they have pain in the inguinal region, that is this below, right lower abdomen or left side. Inguinal regions are two sides, left and right. So you can have hernia on the right side or the left side, any sides of the inguinal region. You will feel pain in the inguinal region, which sometimes when you do some excess work, lift heavy weights, you feel discomfort. These are the starting phase of the inguinal hernias. Then slowly what happens is whenever you do lot of walking, you stand for a long duration, you feel some bulge in the lower abdomen. So you should not worry much about it. So whenever you feel something coming out of your inguinal region below and you feel some discomfort, then you have to visit to a surgeon. Whenever you visit to a surgeon, we'll get the ultrasound done, all the necessary investigations, and then we will see how much is the defect. Defect is how much the opening has come inside the your abdominal wall cavity. If it is 1, 2, 3 centimeter, you don't need to worry. But the thing is, when the size increases increase the size, then there's a problem comes. Okay, so you have to be very cautious about these hernias. You come to us, then the surgeon will do the ultrasound abdomen. We find there's a defect. Then what to do for that? Then the only treatment for that is go for a surgery. Nowadays we are doing laparoscopic and robotic surgeries. So laparoscopic, robotic, they are very good for the hernia surgery. We'll be putting a mesh inside, and then there will be all small hole surgeries. Your patient will be discharged on the next day of the surgery. This should be the hernia should be taken very seriously, as if the size of the hernia increases. If it is less than 1 centimeter, okay. If it is more than that, then the problem comes. What happens is the intestine, they come out of the hole and they won't go back. So what happens is they strangulate in the hole. So what happens, the blood supply of the intestine goes off, and slowly these become complicated. Intestine lose their blood supply, patient go in sepsis, and this it become a complication for all the patients. So I request everyone, you should know about the condition which we see nowadays, inguinal hernias, and be cautious about it. I hope you got my points. So take home messages: whenever you feel any bulge or any swelling in your lower abdomen, if you are if you are a gym worker, you lift heavy weights or anything, then you feel that, you should better visit a surgeon and get the treatment done on time. Don't delay. Thank you so much.